I'll be introducing our next speaker, Andrew Thompson. First, introduce myself. I'm Thomas Hellman, professor at Oxford and site lead at CDL Oxford. It is my true pleasure to introduce Andrew Thompson. Andrew Thompson is a Silicon Valley-based British entrepreneur, 30-year track record, particularly known as the CEO and founder of Proteus Digital Health. This is only one of the companies. He had several other companies that he started before Proteus, including very noticeable FemRx, which was probably a pioneer in what's now known as femtech. So Andrew's really seen a lot of the health biotech world, but he's a very broad person too. He's a co-founder of the Summit Schools, a charter school organization. In conversations, he mentioned that he's been an advisor to the government of Estonia and a number of other things. So he's a very broad thinker. He's a Cambridge University graduate. We love that at Oxford. And he's got over 50 patents. So he's a scientist. He then did an MBA at Stanford. And in fact, it's at Stanford that we first met. I remembered him as one of my most noticeable guest speakers. He was unusually insightful and extremely articulate. That's why it's my pleasure to introduce to you today Andrew Thompson, who's been active both at CDL Oxford and CDL Toronto. It's a pleasure to have you, Andrew. Over to you.
Great, Thomas, thank you very much. I think I have some slides, which I think Rachel's going to drive for me. It's a big topic. I'm going to build on some of the themes that Ali just covered with respect to tech. We don't have much time. I'm going to try and be bright line. There's not much time for nuance. I'm going to talk over these slides. If you want to read them, you can. There are 4 questions that I want to try and address: what, who, when, and where. We can answer the first 2 questions immediately. When, now, and where, USA. 50% of the healthcare revenues in the USA and 90% of the profits are there. So we're left with what and who. I'm going to keep everyone in agonizing suspense for 3.5 minutes, and then I'll let you in on the scoop. So let's start with digital. What is it? It's a stack of technologies. What digital does, it turns data into bits and bytes. It makes it connected, available, ubiquitous, and multimodal. And these are some of the things that we just touched on with Ali. In the last couple of years, AI has become mature, it's ready for broad adoption, and this is a massive step change in the power of these kinds of digital solutions. What does digital really mean? It means we can shift service and business models from building people, product, professional, into models that are increasingly about mobile, software, service, and consumer. This is a massive opportunity economically and socially. The social implications potentially more important than the economic ones. We're increasingly concerned everywhere about disparities, and healthcare and education are frankly at the root of those issues, and they can be transformed from a service perspective and an access perspective by these technologies. Next slide, please. Okay, let's go to healthcare. It can mean many different things. Actually, what we have today is not really healthcare, we have sick care. Healthcare, as we know it, is provided, in my view, by unrecognized heroines called mothers. We have a massive life sciences industry, an emerging wellness sector, and my point here would be that within wellness, transformation of the food industry is absolutely key. And then we have healthcare IT. To answer the what and when questions, I'm going to focus on sick care, healthcare, and life sciences. If you want to talk about food, let's do that offline. I think CDL should make nutrition and food a separate track. Next slide. Digital sick care. This is the adoption of technology in the traditional sick care system. It requires co-invention. That means rules and regulations and reimbursement need to change for it to happen. What's interesting here is that EMRs got adopted because they got mandated, and video consults got adopted because they got reimbursed and they got mandated. They're both good ideas. They've both been implemented very badly, and doctors need to be trained to use computers in front of patients because they're very bad at it. My own view here is that the potential is limited because this is more or less using Amazon's technology to make it easier for clerks in bookstores to check you out and find your novels. So this isn't the most interesting area for me. Let's go to the next slide. Healthcare. This is a massive opportunity, could be trillions. This is about consumer empowerment. It's something that doctors' guilds are afraid of, nurses' unions don't like, and these are rational fears because lawyers, accountants, and bank managers have all had their livelihoods significantly changed by these kinds of technologies. But this is where the real potential to empower and emancipate lies. This is massive social and economic potential. It can be substantially enhanced by artificial intelligence because artificial intelligence is a lot faster and frankly a lot more accurate most of the time than human intelligence. So the key in this space is to fly below the regulatory and reimbursement radar. You've got to be in gray space. Think about Uber, who had a car service that's not a taxi. That's the kind of approach we need. You want to work with young technical and medical professionals who see consumers as partners in care, not as threats to their livelihoods. Next slide. Let's go to digital life sciences. Ali touched on this. This is a huge industry. I think the potential for AI in this sector is probably the greatest of all these sectors. It's very important when you use these tools inside this sector that you minimize the need for co-invention. That means regulatory and reimbursement and other changes. Regulators today are mainly experts in chemistry and biology. Reimbursement is controlled by incumbents, and the incumbents don't do physics either. And so there's a huge skills gap here between the incumbents, the regulators, and the innovators. Next slide. So I was asked to say, where would I find opportunity today? Here are 5 CDL companies that are likely great opportunities. They all, in my view, could be on the main stage. Answers to what, who, when, where, what. It's AI-enabled solutions to big problems that avoid incumbents and avoid co-invention. Who, these companies are led by super bright young talent that understands the tech stack. It understands AI, it understands chemistry, it understands biology, and most especially, it knows and understands physics. When is now, and where it is the USA, because let's build something massive. Thank you.